you ready. Good.
I don't know if I should narrate or just talk or just be in the scene.
Narrate it. They can hear you. Just shut the door.
Really, you need to do it.
Okay, we're going to start filming. Guys, we're coming in just complete silence, okay?
Bring yours off.
So maybe more of a question answers structure.
Okay.
I'm thinking.
So go ahead and get started. Did you have that needle or should I use a
Oh
different
yeah.
one?
Yeah. One second.
So we're here at Elase Spas with Chad
Hi.
and Andrea. How do you say your name?
Kylene.
Kylene. I wanted to say Kylie, but I was
You
like,
can say Kai.
Kai.
Yeah. So today we're here just with our guest patient, Kylene, and she's a practitioner here at a prominent medical spa in Utah. And myself, I'm going to go ahead and narrate just some simple points here to begin kind of a virtual training strategy. Enough of, I think the sales reps have watched enough content online to understand the process of what's going on now. We've followed the protocol for the procedure. We cleansed the skin. We applied a anesthetic, and that is going to be something that every spa will typically have in-house, so you don't have to worry about a prescription for yourself. You can have them, in my opinion, I think it's the best strategy to have them invite their own patient, someone that they already know of within their client database that either has a skin tightening desired result or wants to work on some pitted acne or stretch marks, surgical scars, and skin texturizing. If you have that conversation with the practitioner beforehand, they can find that person that they think is a prime candidate. So that shouldn't be a problem. So they can either come in numb, because they'll have a prescription for numbing cream, or they can come in and you let that numbing cream set for about 30 minutes before you do the procedure. As far as the pain tolerance, Andrea, how do you feel?
I'm okay.
Okay, scale of 1 to 10.
Worst,
Be honest.
Probably the worst. It's probably like a 3.
3 being bad?
On a 1 to 10, it's probably a 3.
Not too bad, okay. So the forehead is obviously thinner skin, and the protocols that follow the Dermapen treatment, they basically are very specific per area of the face, per speed of the device. So they're very, very specific, and they're easy to basically learn and pick up, and the estheticians or practitioner wouldn't take them more than 5 minutes to look over the protocols. That's a big plus. So at the numbing cream, we wipe the numbing cream off. We're going to apply an alcohol wipe or some type of antiseptic just to make the skin free from any type of bacteria and just really get everything primed, ready for the treatment. What she's doing now as far as reaching for hyaluron and hyaluronic acid mixed with a B5 concentrate. You've got a phenomenal serum that's designed to promote that healing process. Hyaluron itself is a protein. It's naturally found in your body. You're not injecting anything artificial. You're just simply helping the process of the healing or the healing process start after the treatment. You're also promoting, that's a protein, so you're promoting moisturizing and binding properties. So nice and plump skin is the result.
So I noticed that she's going over the skin a couple times in the same area. What's the protocol there?
So we have 3 passes per section, and she'll actually divide the face into sections like Nice comment, Mike. The forehead, for example, is the first section, and she'll take 3 passes over that entire section before she's done. The first pass is her choice, vertical, horizontal, and she follows up with the third pass with circles. I like that strategy just because you may have missed something with the other 2 passes. This gets everything. Notice the micro bleeding, we call it. There's very, very small micro damage. It appears, upon even the first or second or third pass, but after a simple wipe of the forehead with some gauze, it'll just be red in appearance after that.
So there's no scabbing, there's just micro bleeding and it goes away.
Right. No scabbing, no flaking. This is going to be a redness for maybe up to 24 hours. Every patient or client is case by case. Take into effect age and skin thickness. So if they are, in that 40 to 50-year-old realm, then be prepared to tell them that they may be redder for maybe another 12 hours than expected. But after typically 3 days, you're back to normal. So prior to coming in, Andrea had a clean face, obviously no makeup. And some of the regimen for the pre-regimen for this treatment is, be clean, have your face cleansed. Obviously following, the Esthetician 101 is no sunburns. Basically contraindications meaning no cystic acne or live acne, nothing in that, really eruption stage. Basically, autoimmune therapies or Retin-A is discontinued 12 hours before the treatment. Rosacea or other skin types that seem maybe questionable is definitely do not treat a rosacea as far as the area being severe. If the area is maybe minor, we can definitely treat the area with minimal settings. If it's just inflamed, it's going to aggravate the situation even more, so avoid it altogether. And post-treatment, when she's done, she wants to avoid swimming pools and direct sunlight. Obviously, her face is going to be very sensitive, and we want to avoid the gym and no workouts. Don't go to the gym and touch weights and then touch your face and wipe your sweat off. It's just going to be your canvas is really going to be ready for any type of bacteria to possibly form and an outbreak as possible. So want to avoid the gym.
So are the needles making holes in the face?
Yeah, what we're doing is the actually collagen induction therapy, CIT, is really the science behind what we're doing. And if we date back that science to about 1997, the first needle dermabrasion therapies were documented. And what they were doing was they were working on facelifts. Those early facelifts left pretty unsightly scars, and the first attempt to treat those was actually to hide them. So they did something called micropigmentation. So they would inject pigment into these scars so that they could look more attractive, and the body metabolizes pigment over time, so that didn't really work. What they did notice is that the needling helped the scar in size, reduced it in color, reduced it in softness, and so it faded the scar, and it led to them doing just dry tattooing. And tattooing became more mass accepted by not tattooing, but more of a manual application. They developed something called the derma roller. The derma roller is, if you've seen a lint roller, picture the lint roller you have at home, and that's really what it is. It's a stick, and at the end is a drum, and they have attached needles to the end of the drum and wrapped it in needles. And those needles can be in different lengths depending on the different roller you buy. So the treatment involved basically taking the roller and, if I can mimic the action, taking the roller, my hand in there.
We'll cut it in.
Good.
We can put a roller in the shot.
Oh yeah, that's a good idea.
We can do all kinds of editing.
That's why Mike's here. Okay, so picture roller's in the shot, and you actually roll across someone's face. Kind of the same protocol we just did with the Dermapen, but much more hard to manage, to maneuver. The size of the derma roller is a problem. You notice the Dermapen tip actually has about a ½ inch, exactly, 0.5 inch diameter. So that can treat all those hard to reach areas like the nose and the upper lip, and you don't have to worry about gouging somebody's eye with a medieval torture device. You can basically have something more clinical and professional. So now we have the world's first automated skin needling device. It's a concept that a lot of people I've talked with have mentioned, that are in the industry, have mentioned, wow, that was my idea 5 years ago. You took my idea and you guys actually did it. So we know we actually, from talking to the market, we definitely have something that if you're a derma roller practitioner, it's as easy as walking in and swapping out, the old for the new. If you have, I guess, a chance to talk about the market itself is maybe appropriate. We've got, I like to call it the totem pole strategy. In the cosmetic industry, you've got, on the high end, you've got dermatologists and plastic surgeons who have access to all kinds of nifty devices, and they do cost anywhere from $50,000 to $100,000 for these lasers. They may not see immediate advantages to replace it with something like this. However, there is a place for the Dermapen at every level, in my opinion. Either it's an add value or to increase effectiveness behind treatments. The next tier down is where we're at now today at Elase. And Kylene, basically, maybe you want to field some questions for us?
Yeah, absolutely.
So what, as far as a medical spa, which we're in, how do you feel the Dermapen is, where does it fit, and why is it attractive?
It fits for a lot of practices that do any kind of skin resurfacing, anything with an IPL laser or a skin resurfacing treatment, any of those treatments. Clients are coming in for and they're asking about and they're curious about because they're seeing them on Dr. Oz, they're seeing them on all of those TV shows, so they're already curious. A lot of clients aren't the ideal candidates for some of those treatments. If you have any clients with ethnic skin, the skin resurfacing IPL treatments are not for them. It's harmful for their skin and it's not really an option for them. And that's one of the reasons I like the Dermapen is you're not worried about contraindications or you're not worried about any bad results that may come because the Dermapen is safe and your clients are happy with that. They're happy to know that there's nothing that they should be worried about or nothing that could go wrong with the Dermapen.
Perfect. How does it compare to other popular treatments out there right now? And maybe some of those, list maybe some of those for us.
Yeah, it is comparable as far as result goes to a skin resurfacing or an ablative treatment. It's very comparable as far as results go. Another thing that your patients are really going to like is anytime you're doing an aggressive treatment on any patient or any client, you do worry about their downtime. You worry about the next day they're going to call, they're going to be worried or wonder if what their skin looks like is normal, if they're going through the right step-by-step process, because a lot of those treatments, skin is, it's sore afterwards, it's tender, they have a lot of redness, they have scabbing, all of those things that people are worried about. You don't worry about that. You don't worry about your clients calling and concerned, and your clients love that too because they don't want to take time off of work. They don't want to, sit in their house and be afraid to go to the grocery store, things like that. And a lot of patients feel like with an aggressive treatment, that's what they're going to have to do. They're going to take time off work. They're going to put their life on hold to have these treatments. With the Dermapen, you don't have to do that. And that's a great selling point.
Perfect.
Did you want her to do your neck, Andrea?
I don't think they put numbing cream on it.
Oh, I'm sorry. It's okay.
So you're treating each area according to the protocol depth chart. After each section's treated, you'll notice she just takes a simple swipe of the gauze and cleans that area first before she moves on to the next area. She follows the same vertical, horizontal, and then third pass with circles on each area.
Do you think it helps with the size of pores? I have a lot of patients that have asked, will it help with the size of my pores? Do you think it helps with helping with creating smaller pores or making the pores more even? Or what's your comment on that?
Absolutely. You know, when you're doing the Dermapen, you're getting a certain level of exfoliation, and anyone in the industry knows that the more you exfoliate, the more you get the oil out of the pores. The longer you let that oil sit in the pores, you know, the more those pores are going to grow and stretch. So with doing the, you know, light exfoliation and regular exfoliation that the Dermapen provides, you are going to help reduce that sebum. Oh my gosh. Can you edit that out?
Oh yeah.
Absolutely.
I can't believe I did
Absolutely
that.
not.
It's all right.
You don't know our sales reps. They're going to love that part.
The sebum buildup. Very similar words. I apologize.
Sebum buildup?
The sebum, yeah.
Sebum.
Okay. We'll do your lip. You ready for that?
This is the most sensitive part. So it helps with fine lines, it helps with wrinkles, it helps with skin rejuvenation.
Acne scarring
Scars.
is huge. It helps a lot with acne scarring. And you're going to have a high population of clients looking for help with acne scarring.
The physiology behind, you know, CIT or collagen induction and what we're doing is really the same premise for those popular laser treatments that are 10 times the cost. And maybe we should talk about the cost in a minute, but